Good evening, everyone. Welcome to our Facebook Live on nursing prioritization and delegation again tonight. Thank you very much for being here. And as you can see, we have a lot of students in the comment section earlier. So we're doing a shout out. But anyway, thank you very much again. Before anything else, it's Thursday. We're going to have our Facebook Live again. That's going to be somewhere from 7 to let's say 8 p.m. We will find out, okay, if we reach 8 p.m. Also, before anything, I would like to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator. I have been teaching nursing students for almost 25 years, also in nursing faculty, and also teaching students pass their NCLEX examination, of course. And also, I am the founder and the president of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy, and also a published author of a book that I have in Amazon. It's called the Simple, Fast, and Easy NCLEX Review Book, and you can also buy that in the Philippines as well. You just have to email Matus Nursing Review Academy at gmail.com. Okay, so thank you guys. Before anything else, again, I would like to some shout outs here, interesting comments. So we have Elenita said, I had a lot of prioritization questions. Yes, that's very good to know. Also, Charlize is here. We all know that Charlize already passed her NCLEX last week. So she's still attending our Facebook Live tonight, and that's really very interesting. And also Kadiatu Chawali, she's our winner last week, I think in the last 2 weeks, and she's now enrolled in our online NCLEX Academy also. So nice to meet you here, Kadiato. And then also, that's it. Well, anyway, tonight, everyone, we start with, okay, our motivational photo of the week. Our motivational photo of the week was sent to us by Sharon, and she's studying with our online NCLEX Academy. Okay, so that's the very nice picture, and you have your cake there. So I hope that that's inspires you more to review when you have food beside your computer. Okay. Also, another one, everyone, is I would just like to give a shout out to one of our recent passers, Sarah. Sarah passed the NCLEX, I think, 2 days ago, or NCLEX-RN in California. So she said in her review, Facebook recommendation, which is, I just found out yesterday that I passed my NCLEX-RN at first attempt and could not be more grateful to Mr. Matus to provide such a wonderful resource to study the content. I participated in a 12-week fast-track live NCLEX review webinar, which we do every Tuesday. It worked very well for me. I prepared for the Tuesday evening webinars by reading the eBook, listening to the amazing videos in the Academy, and filling up the workbook. The live webinars helped me to understand and remember the concepts better. Mr. Matus have very entertaining and fun style to teach, and he has many stories to add, which makes the subjects even more interesting. The book is also straight to the point and easy to understand. So again, congratulations, Sarah, for passing your NCLEX-RN examination. One of our success stories again this week, and I'm so happy about that. We also have another student who attends our Facebook Live. It's Hilda. She also passed her NCLEX examination. So let me know if this Facebook Live every Thursday is helping you pass your NCLEX so that we can congratulate you. Okay? So we have a new person who just came in. It's Nona. Hi, Nona. Okay, good evening. So again, for tonight, we're going to have your chance to win the free 90-day online access NCLEX review. We give away that every week. So at the end of the session again, or this program, we're going again to announce the winner of our free 90-day online access review. So wait until the end of the program so that you can see if you're the one who won the free 90-day online NCLEX review. Okay, so if you attend tonight, you will be entered into a raffle, and we will announce the winner for next week. Okay, all right. Okay, so yeah, this is every Thursday 7 p.m. we do the Facebook Live. If we cannot do it in Thursday or something, we will make a special announcement. So please visit our business page, Matus Nursing Review, regularly so that you can see any announcements about this session. But we try our very best to do this every Thursday as much as possible from 7 to 8 p.m. Okay? So hope to be the one. So hopefully, Charlene, you will win tonight. Okay. Now, also, I would like to request everyone if you can share this, and if you're watching this in YouTube, then you can also subscribe, everyone. And I also have good news for everybody. We recently received a notification that we are now a YouTube partner. So YouTube partner means that we have access to all features wherein we can improve our YouTube videos, everyone. So share and let your friends know about this Facebook Live, everybody. So I would really appreciate that. Thank you. All right. Does anybody have an idea of what's the focus tonight for Facebook delegation and prioritization? Does anyone have an idea? Okay. So our focus for tonight is going to be something about, okay. So we have this picture. So what do you think is that, everyone? That's going to be our focus for tonight. Okay. All right. So our focus for tonight is going to be questions on newborn, care of the newborn, or even postpartum care. All right. So that's going to be our focus for tonight. So we have two prioritization questions, and then we also have two delegation questions. Okay. All right. So Elenita said, thanks. I'm going to be joining every Thursday. I really need to pass. Very good. Okay. So Cherry said that she's still here. She just got her license last Tuesday, but still she wants to join the program. Very good, guys. Okay. So let's have the first prioritization question for tonight. So it's going to be pediatric nursing and postpartum care. So our first question for tonight, everyone, will be, okay, are you ready, everyone? Say yes on the comment section, because we're about to reveal to you our first prioritization question. And again, the format is almost the same. It's going to be 4 patients or clients, and then you have to choose the most unstable. I would like to remind you that sometimes in the NCLEX, you have to choose the most stable. Okay, so but usually you have to choose the most unstable and who's a priority. So let's see. Okay, so all right, 3, 2, 1, everyone. Here's your first question, everybody. Okay, without further ado, so number 1, the nurse cares for several neonates in the nursery unit. Which newborn infant would require intervention? A, the 12-hour-old newborn who regurgitates milk after feeding. B, the 2-hour-old newborn who has an irregular pulse at 150 beats per minute. C, the 6-hour-old newborn who has a respiratory rate of 50 breaths per minute. Or D, the 5-hour-old newborn who has yellowish discoloration of the skin. Again, so the nurse cares for several neonates in the nursery unit. Which newborn infant would require immediate intervention? A, the 12-hour-old newborn who regurgitates milk after feeding. B, the 2-hour-old newborn who has an irregular pulse at 150 beats per minute. C, the 6-hour-old newborn who has a respiratory rate of 50 breaths per minute. Or D, the 5-hour-old newborn who has yellowish discoloration of the skin. And I would like you to indicate the rationale for the answer that you have chosen. So what is the rationale for the answer that you have chosen? So everyone, let's learn from each other. Okay, let's see what is your rationale for the question or for the answer. Okay, so what is the rationale, everyone? All right, so some of you are answering A, some of you are answering B, some are answering C, some are answering D, A. All right, so let's see what's the answer to this question, everyone. So again, this is a question wherein you have to go back to your content again. Content, which one is abnormal or which one is not abnormal, okay? Which newborn would require immediate intervention, okay? All right, so let's have the answer to this question, everyone. So you always have to remember that There are normal characteristics of the newborn, and there are abnormal characteristics that you need to report. And newborn assessment is very important because we need to make sure that we discover deformities, anomalies, or any problem that needs to be reported immediately. Okay, that is highly important in the NCLEX. So the answer is going to be, let's see everyone, you're putting all your rationale. So some people said there could be sudden infant death syndrome. Okay, so the answer to this question is going to be, all right. And one reminder to all of you guys, when you answer the question, you really have to use the process of elimination. Okay, use the process of elimination. You really have to read A, B, C, D. Just because you saw letter A, you already have an idea what's going on. But what about the other options? You really have to read all of the other options and ask yourself, are these normal or abnormal? Do not choose an option and not look at the other options anymore. Okay? You have to look word for word, A, B, C, D, analyze each item, and then eliminate and use the process of elimination. And then you have to give your answer. Don't choose an answer just because there's something there, a word, and you're so excited, but you did not look at the other options anymore. So, in this question, I would like you to look which ones are normal and which one is abnormal that you need to provide immediate intervention. So the answer to this question, everyone, is going to be letter D is the answer, everyone. Okay? Now, why is the letter D the answer? Because yellowish discoloration of the skin or jaundice. This is a very important concept in newborn care or assessment. Any jaundice that happens within 24 hours is considered to be pathologic jaundice, which is abnormal. So letter D is a 5-hour-old newborn, and that is considered to be pathologic jaundice. The physiologic jaundice or the normal jaundice in newborn is supposed to appear 2 to 3 days after birth. Okay? But if you have jaundice within 24 hours, that is considered to be pathologic jaundice. I think someone earlier mentioned about pathologic jaundice in the rationale, so I wasn't able to pick that up, but then that's exactly correct. Now, someone mentioned here that the normal respiratory rate for the newborn is 30 to 60, and that is exactly correct. And that's why your letter C is not the answer, because 50 is considered to be normal. Okay, your letter A, you always have to remember regurgitation is normal or expected, especially with a 12-hour newborn, because of the immaturity of the cardiac sphincter, and that happens. Okay, if the regurgitation is accompanied by cyanosis, for example, choking and coughing, then that is a different story, because regurgitation with cyanosis means that there is a physical deformity. All right. Now, letter B, irregular pulse that is normal for a newborn to have an irregular pulse, especially 150 beats per minute, because the normal is 110 to 160 beats per minute. So remember that, everybody. All right. So that's why A, B, and C, we consider them as normal findings in a newborn. All right. Now, letter D is going to be the answer. I hope everybody got that right, because this is a very important concept in your NCLEX examination. Okay? Okay, so let's proceed. All right, so before I proceed, everyone, I would just like to let you know. Okay, so these are the danger signs in newborns. Okay, so you need to report if the pulse rate is more than 160 or it is less than 100 beats per minute. Any respiration that is more than 60 or less than 30 breaths per minute, noisy respirations or wheezing, nasal flaring, chest retractions, temperature above 37.7 degrees centigrade or below 36.2 degrees centigrade, extreme irritability or lethargy, circumoral pallor, which is the pallor around the mouth, shrill or high-pitched cry, which may indicate the presence of increased intracranial pressure, jitteriness also, which may indicate the presence of hypoglycemia, poor feeding, no urine or bowel movement in 24 hours, or urine which is 48 hours, convulsions, excessive drooling, vomiting, and jaundice within 24 hours. You have to remember that for newborns, especially in the first few hours, drooling is not normal because newborns normally do not produce your saliva yet. So excessive drooling could be a problem also. All right. So remember all of these guys. This is just a minimum list of the danger signs in newborn that you need to report, and we need to do further evaluation. Okay. All right. So there you go again. Content is very important, everybody. And again, strategy is also very important in the NCLEX examination. Don't just choose an option because, oh yeah, this has something to do with airway. Don't do that. You really have to look at each option, A, B, C, D, and then you have to use the process of elimination. And you have to ask yourself, is this an option that deserves to be eliminated? Okay, but of course at the end of the day it's all practice, it's all giving your time to really review. An NCLEX review, when you review for the NCLEX, it's not something that you can do overnight. It is something that you have to prepare, put in your calendar, and really study the content and do some practice questions every day as well. They go together hand in hand, your practice questions and at the same time studying the content. Okay. All right. So let's go to number 2. Okay. And you should know also that we have a lot of these Facebook live recordings in our YouTube channel, so you can watch them also. All right. So number 2 question, everybody. Let's have this, everyone. So this is another prioritization question, everybody. Okay. The registered nurse supervises a new nurse in caring for neonates in the nursery unit. Which of the following observations warrants further intervention? Okay, so let's have letter A. All right. The nurse counts the respiratory rate before taking the temperature. B. The nurse suctions mucus first from the mouth and throat and then from the nose. C. The nurse positions the newborn on a prone position after wrapping with a warm blanket. Letter D. The nurse measures the chest circumference by placing the measuring tape at the nipple line. So again, the registered nurse supervises a new nurse in caring for neonates in the nursery unit. Which of the following observations warrants further intervention? A. The nurse counts the respiratory rate before taking the temperature. B. The nurse suctions mucus first from the mouth and throat and then from the nose. Letter C. The nurse positions the newborn in a prone position after wrapping with a warm blanket. Or letter D. The nurse measures the chest circumference by placing the measuring tape at the nipple line. All right. So what is a correct answer in this question? Always use the process of elimination. It could be a difficult question. You may have a hard time eliminating some options, but if you know something is really wrong, then that could be the answer. This question is what you call a negative question. A negative question in the NCLEX usually will say further reinforcement, further intervention, warrants intervention, something. When you say negative question means that 3 options are correct and 1 option is wrong, and that wrong option is the answer. Okay, so let's see the answer to the question. Most of you, I think, got the right answer. So for tonight, everyone remember that for tonight, we're not just learning basically the content, but of course, we're learning your approach or your strategy and learning from everyone. It may only be a few questions, on Thursday. However, if you really have to look at the whole picture when you watch all of these videos every week, then you get motivated and also your ability to process information and approach questions strategically is also improving. Okay. All right. So some of you answered. Okay. So always remember in the question, read word for word. Okay. So let's remove this. The answer, everyone, is going to be very good, everybody. So you answered letter C. Most of you got that. Caroline also got that answer right. Claire, okay, got that right as well. Okay, very good. Now we have, so very good. C is risk for SIDS. That is exactly correct. Okay. Safety of the newborn. Very good. That is a correct answer. Letter C, everyone. Okay. Now, when you look at letter C, everybody, the nurse positions a newborn in a prone position after wrapping with a warm blanket. You may not see the word prone position. Just the word prone position. We have to remember that many years before this, prone position was the preferred position for newborns after birth in the U.S. However, the latest recommendation now is that newborns must be placed on their backs or the side in order to prevent sudden infant death syndrome. Very good. So in this question, everyone, okay, so remember, letter A here, the nurse counts the respiratory rate before taking the temperature. That's exactly correct. And you know why? Because if you take the temperature before counting the respiratory rate, taking the temperature, auxiliary temperature, for example, that will cause the newborn to cry, to cry or to get excited because of the contact with the thermometer. So that's why we have to count the respiratory rate before taking the temperature. Okay. Then letter B, suctioning the mucus first from the mouth and the throat, then the nose. That is exactly correct. And then letter D, measuring the chest circumference by placing the measuring tape at the nipple line. That is the correct technique. So congratulations, everyone, for getting the correct answer. Very good. Okay. So let's proceed, everybody. All right. So we have been doing this Facebook Live since April this year, and we have tons of videos available for you already for this practice. Okay. Now, so this is just the recommendations or reminders from the Centers for Disease Control and Prevention. We're in to prevent sudden infant death syndrome. You have to place the newborn on his or her back for all sleep times. For example, napping or even at night. Use a firm, flat sleep surface such as a mattress in a safety-approved crib covered by a fitted sheet. Keep the newborn sleep area in the same room where you sleep until your baby is at least 6 months old, or ideally until the newborn is 1 year old. Keep soft bedding such as blankets, pillows, bumper pads, and soft toys out of the newborn sleep area. And lastly, do not cover the newborn's head or allow it to get too hot because it can lead to sudden infant death syndrome. So always place the newborn on their backs. Okay? So that is just really a quick reminder, everyone. So those are our prioritization questions. So congratulations. Now, before we go to our delegation question, I would just like to make an announcement that we rescheduled our 10-day live comprehensive NCLEX review. We are going to have that now every Saturday, November 7 to January 16, 2021. So just visit our website if you would like to register for our 10-day live NCLEX review webinar every Saturday for 10 days, everybody. Okay? All right. Are you ready, everybody, for the delegation question, everyone? All right. So delegation question is a big part in the NCLEX as well. And I'm so happy that a lot of you watching the videos have been learning a lot in terms of delegation in nursing. So let's have the first question, everyone, for delegation. All right. The registered nurse or RN is giving assignments to the unlicensed assistive personnel in the postpartum unit. Which of the following tasks can be delegated to the UAP? Select all that apply. All right. Hopefully everybody can hear me. All right. So letter A, assist the mother to the bathroom to void. B, check if the uterus is soft and boggy. Okay. C, demonstrate to the mother on how to breastfeed. Letter D, obtain vital signs every 4 hours. E, assist the mother in taking a shower. Or F, provide instructions on follow-up appointments. Okay, again, the registered nurse is giving assignments to the unlicensed assisted personnel or UAP in the postpartum unit. Which of the following tasks can be delegated to the UAP? Select all that apply. A, assist the mother to the bathroom to void. B, check if the uterus is soft and boggy. C, demonstrate to the mother on how to breastfeed. D, obtain vital signs every 4 hours. E, assist the mother in taking a shower. And F, provide instructions on follow-up appointments. All right. So again, when we delegate responsibilities to the UAP, we always said this in our delegation practice here that always remember it has to be within the scope of practice. It has to be a stable client. And at the same time, lastly, it has to be a simple routine procedure or task. Okay. So we have different answers, everyone. Okay, people still keeps on answering. Let's see. All right. What is the answer to this question? Okay, everyone, the answer to this question. Okay, Matus tribe, let's see. All right, so the answer to this question, everyone, is going to be... All right, so very good, everybody. So you have your A, D, and E. Most of you got that, everyone. So remember that responsibility of the UAP, assisting the mother to the bathroom to void, is okay. Letter D, obtain vital signs every 4 hours. You can delegate that to the UAP, of course. Assist the mother in taking a shower. You can, of course, delegate that. Okay? So the answer is A, D, and E. Letter B is an assessment. Always remember, what did we say? Okay? Your RNs cannot delegate it. No evaluation, no assessment, and no teaching. And letter B is an assessment, and that must not be delegated to the UAP, right? And then letter C, demonstrate to the mother how to breastfeed. Breastfeeding, that is a skill. So that has to be the responsibility of a licensed nurse. Okay? And letter F, provide instructions on follow-up appointments. That would definitely be the RN or the licensed nurse. Okay? So very good, everybody, for getting the right answer. So Charlene is very happy for getting the right answer to this question. Okay? All right. Okay. Okay, so let's proceed now to... Okay, so before we announce the winner for our free 90-day online NCLEX review, I would just like to give you a shout out about my program. And also, you're making all comments in this section. I'll be responding to them later on. So some of you said that in some questions, I saw no UAP, but choosing taking vital signs is not chosen for LPN. I read the rationales because it is a UAP task. Now, if you have encountered those kinds of questions, feel free to take a screenshot and then send them to me, and then we can actually discuss that also in our next Facebook Live. Okay. All right. Okay, so just a reminder, everyone, for our program, we have Matus Nursing Review Online NCLEX Academy. So definitely we have self-study programs here, and also we have live webinars also. So if you need more information, you can visit Matus Nursing Review Academy.com, or you can also attend our free sit-in classes and also our free orientation course in the academy or in the website. Okay. All right, and then also we also have our pricing for our review program. Some of you have been emailing me about the prices. We're not changing any prices right now, and some of you have been asking about discounts. In terms of discounts, I think in November 1, I think during the Halloween season, I guess we have a sale going on during Halloween, and then also for Thanksgiving. So watch out for the discounts that we will have. Also, if you want to buy our merchandise, everyone, we have the mask. right now, and also we have some t-shirts and sweatshirts also. But the good thing about this merchandise that we're selling is that $1 is going to go to the for every mask that you buy, or for any item. Oh, I think it's the mask. For every mask that you buy, $1 is going to go to a nonprofit for feeding children. Okay. All right. Okay, so everyone, are you ready to, okay, are you ready to, okay, know the winner for tonight's free 90-day online NCLEX review, everybody? Okay, all right, so anyone? Okay, so we have a lot of comments in the comment section. We will verify that, guys. And thank you for the comments, because we can verify the information, and we can actually also correct if we are wrong in our rationals here. All right. Okay, so our winner for tonight, everyone. Okay. Okay, so Lamin Kasama passed. Okay, so thank you very much, Lamin, for passing the NCLEX. Okay, all right, so congratulations. Okay, so let's proceed. That is exciting. When I'm looking at the comment section, it means that you're all learning from each other, everyone. Okay, so very good. So our winner is going to be Beatrice Cantanilla. Okay, Beatrice Cantanilla is our winner for tonight. Okay, so remember this, everyone, that if you join tonight, you can actually be entered into the raffle, and next week you could be the winner. Okay, so thank you very much, everyone. So we have a lot of comments in the section. I'll be going on there later on, and I will be answering most of your questions, everyone. Okay, so excellent responses. Thank you very much for that. Can we please congratulate Beatrice Cantanilla for tonight, because she's the one who won access to the 90-day online NCLEX review, everyone. Okay, all right, so thank you very much, everybody. Okay, congratulations to Beatrice. So again, next week we're gonna have another session. We'll be discussing again your nursing prioritization and delegation. And of course, everyone, from the very bottom of my heart, I would like to sincerely thank all of you for participating every Thursday. And I know that it's challenging to come up with these questions, and of course to discuss the rationals, but it's very inspiring to see all of you and commenting in the section, everyone. So thank you very much, everyone, for tonight, and enjoy your weekend, everybody. Okay.